Pregnancy and childbirth. Childbirth. The expected date of delivery, EDD, is the date on which a woman is expected to give birth to the child she is carrying, pregnant with. It is calculated by adding 218 days or 40 weeks to the first day of the last menstrual period, LMP. Childbirth is also referred to by doctors as parturition. Delivery is the process of helping the child to be born. Spontaneous vaginal delivery, SVD, is a normal delivery. If there are complications, the baby may be delivered by cesarean section, surgical remove. A full-term pregnancy is 40 weeks divided into 3 trimesters. A baby who is born before this is premature, and one born after 40 weeks is postmature. A baby who is born dead, for example, because the umbilical cord is around its neck, is stillborn. A pregnancy may end before term spontaneously with a miscarriage, spontaneous abortion, or be deliberately terminated with an induced abortion, termination of pregnancy. Note, the verb induce means to cause something to happen. Labor, the process by which the fetus and placenta are pushed out of the uterus, is called labor. It is divided into 4 stages. Some words which are combined with labor are premature labor, prolonged labor, spontaneous labor, induced labor, false labor. Presentation and lie. Fetal lie is the position of the fetus in the uterus. The normal lie is longitudinal and the abnormal lie is transverse. Fetal presentation refers to the part of the fetus which occupies the center of the pelvic canal and which the examining finger feels on vaginal examination. Butterworth. The abnormal presentation is with the head vertex presentation. Bridge presentation means the buttocks are presenting. Bridge is an old word for buttocks. Abnormal presentations may require delivery with forceps. The respiratory system. Cough. Cough is a common symptom of upper respiratory tract infection, URTI, and lung disease. A cough may be productive where the patient coughs up sputum, or non-productive where there is no sputum. A productive cough is often described as loose and non-productive cough as dry. Sputum or phlegm may be clear or white, mucoid, yellow due to the presence of pus, purulent or blood-stained as in hemoptysis. A doctor is examining a patient who is complaining of a cough. Doctor: how long have you had the cough? Mr. Helmington: oh, 4 years. 4 years. Doctor: do you smoke? Mr. Helmington: I used to smoke heavily, but I gave up a year ago. Doctor: do you cough up any phlegm? Mr. Helmington: yes. Doctor: what color is it? Mr. Helmington: usually yellow. Doctor: have you ever noticed any blood in it? Mr. Helmington: no. Doctor: any problems with your breathing? Mr. Helmington: yes, I get very short of breath. I have to stop halfway up the stairs to get my breath back. The doctor writes in the patient's case notes: CO, dyspnea, and cough. C, purulent sputum, 4 years, no hemoptysis. Note: the noun phlegm is pronounced phlegm. Auscultation. The doctor is examining Mr. Helmington's chest. Take deep breaths in and out through your mouth. Good. Now say 99. Listening to the chest with a stethoscope may reveal the presence of sounds apart from the normal breath sounds. There are two main kinds of added sounds. Crackles, which sound like hairs being wrapped together and suggests the presence of fluid in the lungs. Wheezes, which are more musical sounds, like whistling, and indicate narrowing of the airways. The sound of an asthma patient's breathing is also called wheeze. The sound heard when the pleural surfaces are inflamed, as in pleurisy, is called a pleural rub. The doctor asked Mr. Hamilton to say 99 to check vocal resonance, which may be increased as in pneumonia or decreased as in pneumothorax. After examining Mr. Hamilton, the doctor adds to his notes: OE, chest, early inspiratory crackles, both lung bass, both lung basses, plus expiratory wheeze. The skin. 1. Some types of skin lesion. Macule, spot, not raised above the surface of the skin. Papule, spot raised above the surface of the skin. Nodule, lump, a large papule. Vesicle, small blister filled with fluid. Bulla, blister, a large vesicle. Pustule, filled with pus. Crust, scab, dried blood, etc. on the surface of the skin. Scales, a thin layer of epidermis separated from the skin. Cicatrixes, scar, a mark on the skin after healing. Nevus, birthmark, a colored skin lesion present at birth. Fleshy Nevus. Mole, a raised brown nevus. Verruca. Wart. A nodule produced HPV. Furuncle. Boil, a large pustule or skin abscess. Note: the liquid, often yellow, formed as a result of infection is pus. If a lesion is pustular, it is filled with pus. Rashes. A single skin lesion can be regular or irregular in shape. When there are multiple lesions, especially macules or papules, the result is a rash or spots in common language. For example, the rash of an infectious disease such as rubella. A rash is said to erupt or break out. My little boy has broken out in spots. A rash in spots or in a rash all over his body. The following features of a skin lesion are usually noted: location, size, shape, color, type. For a rash, note also distribution, widespread on many parts of the body or localized on one part only. Grouping: scattered, more or less evenly spread out, or in clusters, small groups.